Hi, Chino, welcome to this session. I really appreciate you taking time. I know you are so busy working full-time as a doctor, as a hospitalist at Scripps Memorial. And I know you have two kids, one baby and a 5-year-old, right? Working full-time. So taking care of home and the job and it's really busy time for you, but really appreciate you coming to share your thoughts and experience at this challenging time. So my first question is, everybody knows what's going on in the world, but we would like to know what is happening in San Diego. Do you see, today I heard there is like 124 deaths so far, and almost 3,564 people are, confirmed case. Do you see it's increasing or decreasing in San Diego? What's your thoughts on it?
So overall, I think San Diego was doing very well the past few weeks. We had flattened the curve, and because of that, the number of cases was not that much in the hospitals. Every day we were seeing, but it was not overwhelming for the hospital. But the past weekend, some of the beaches were open, some of the parks were open. I think a lot of people are outside, and we really saw that difference this week. A lot of hospitals, especially in Chula Vista, they are packed, they are at capacity, and they are rerouting patients to other hospitals. And I think if this trend continues where we don't do social distancing like we were doing previously, we may see even higher numbers. So right now it is a little bit concerning because we were going on sort of a flat line and it wasn't, much of a concern. But I suspect that the next couple of days we can see even more increase.
So do you hear anything like, looks like this is going to be an ongoing scenario for the next few months, or we don't know, maybe up to September or so, until the vaccine is coming, right? So do you see like are doctors suggesting something to the government? Any idea, like anything specific you guys are hearing other than what we hear on the public?
In terms of opening up the society, you mean?
Right.
Yeah. So definitely, I think the recommendation would be to do it slowly as opposed to doing it, all at once. Once saying we are open, everybody can go out. So definitely the elderly folks who have other chronic medical conditions, they should be staying back home for even a longer period of time. And the younger folks who don't really have other multiple issues, even though they may get COVID-19, it may not be as severe as for the older folks. So definitely our recommendation to the government would be to do it step by step, opening up essential things first. And even when you do go out to grocery stores, anything like that, still continue to do social distancing, still continue to be wearing masks and take all the precautions because this can happen to anyone, regardless of age or anything, but it's much more serious in the older folks. So do it in a step-by-step fashion, and that's our biggest recommendation.
The other question a lot of people have is, regarding the gloves and masks. Like, how often should we change the mask? And is it like, do we have to wear a glove all the time we go out? I think mask is mandatory now. But what is as a doctor, what do you suggest?
So definitely, mask is definitely a required thing right now. So basically, a lot of people are asymptomatic carriers, which means they don't have any symptoms yet, but they have the virus. And the asymptomatic carriers, they can transmit the virus. So wearing the mask really is to protect the people around you because you don't know who the person next to you in a grocery store. It could be an person going through a chemotherapy or somebody whose immunity is not as good as yours. So the mask is definitely to prevent the infection going from you to somebody else. Even if you wear the mask, you still have to wash your hands and take care of your self-hygiene because that's how you're going to prevent the virus from getting into you. So definitely in terms of reuse, every time you use the mask, you come back home, you should use another one or wash the one that you have as a cloth mask. So ideally, what we use is disposable mask. We throw it away and take a new one because it can get contaminated. So regarding the gloves, every time you're going and touching a public surface where other people will be touching as well, a glove is recommended. But the key thing with using the gloves is once you're using it, don't attend your phone, don't touch your phone or don't touch your keys with it. Don't touch the steering wheels of your car on your way back because that's going to contaminate everything. So as soon as you finish your grocery shopping, throw those gloves away, wear a new one, or wash your hands, don't wear a new one, wash your hands, hand sanitize, and come back home. So that's the main thing about gloves. Just because you wear gloves, that does not mean you're free of the virus, right? You can still contaminate yourself.
What do you recommend for us to keep healthy and increase our immunity? Because I think that is the most important thing normal people can do right now, staying at home.
Sure, sure. So the most effective way, like we know already, is social distancing and hand hygiene. But apart from that, this is a viral infection. And the way we fight a viral infection is through our own body's immunity. And there are a few things we can do to get better immunity. And the first thing is a balanced diet. Balanced diet would mean carbohydrate, protein, and fat. So it doesn't have to be any sort of, you should not be in any sort of special diet right now. If you're having a low carb diet or low protein diet, this is not the time for that. Right now, you should be having a very well balanced diet. Drink a lot of water. Water is underestimated, but 2.5 liters to 3 liters of water per day is what's recommended. Because that's going to help get rid of toxins from your body. It's going to help deliver tissues, oxygen to the tissue. So in that way, drink lots of water. Vitamins are very important for building immunity. Most importantly, vitamin C, vitamin A, and vitamin D. We can take supplements for this. Some of this you can get from food, but if you're not eating enough or if it's not well balanced enough, then you can take supplements. Sleep is also underestimated. 7 to 8 hours of sleep is what's recommended, because when you're sleeping, biologically speaking, there are things that are made in your body that's going to help with your immunity. Avoid smoking and alcohol. Smoking is self-explanatory. This virus is attacking your lungs. So you want to not give your lungs any strain. So if you're smoking, quit smoking. Avoid alcohol, because alcohol dehydrates the body. That's the most important thing in this context. And we want to hydrate the body. And finally, don't be stressed out, because when you stress, your steroid production in the body is going to go up. And when the steroids go up, your immunity goes down. So don't stress about things. Try to take it easy. And use this lockdown period to kind of gain that mental strength. If you're going to get it, you're going to get it, but we're going to fight it. I mean, that should be the spirit, as opposed to being scared and panicked about it at all times.
Finally, I have one more question. So if you see some symptoms of COVID, what should we be doing right now in San Diego?
So right now, the recommendation is go get tested, because now we have tests available, not as opposed to the first few weeks when the tests were not as much. Now we have good testing available. So if you have any sort of symptoms, you should get tested. The symptoms could be fever. It could be, some people don't have fever. Some people have coughing. Some people have sore throat. Some people have headache, body aches. Similar to the flu, but right now the flu season is kind of over. We're not seeing as much flu. So if you're seeing all those symptoms are similar to the flu, you should definitely get tested.
Is it calling 911 or calling your primary doctor?
Calling your primary, right. You don't have to call 911 if you don't have any urgent symptoms. Urgent symptoms would be severe difficulty in breathing, like you can't take your breath, you pass out, you start seeing bluish discoloration on your face. That means there's not enough oxygen supply. Those would be the concerning things to call 911. Otherwise, with these symptoms, you call your primary care physician, or you take any hospital that's nearby you. They'll have a COVID helpline, a phone line that you can call, and then you ask their assistance in terms of where to go for testing. Most places now have drive-through testing, where you don't have to get out of your car. You sit in the car and they do drive-through. Most outpatient clinics have that, and then you just get tested that way, and you get to know about it the result the next day. But the most important thing is to self-isolate. Even before you do testing, or the testing is not back yet, you still should isolate from the rest of your family members. And that's how you're not going to spread it to your family members, even at the start of whatever symptom it might be.
Yeah. That's a lot of good information. Is there anything else you want to share at this time before we
So what I want to share is that, definitely, like I said, things are not bad here. Things are not as bad compared to some of the other states, but that does not mean we should stop doing what we're doing. We're only in a good state because we're following what we're supposed to follow in terms of social distancing. So continue to do that. Even when we are out and about, just keep that in mind, that this has not gone away. We have medications on trial. One medication, as some of you must have heard, is approved for use. So that's a good thing. But we still need a vaccination, and we still need a large amount of immunity to be built up. So keep that in mind. Social distancing is key. Hand hygiene is key. Anywhere you touch, just make sure that you don't touch your face without washing your hands. That's about it.